Mercer County, several cases of Legionnaires' disease are under investigation in Hamilton Township, and in one case, a person died.
I want to bring in Dr. Mike for this one. Good to see you, Dr. Mike. So we keep hearing this Legionnaire. What exactly Legionnaires' disease?
Well, it's a bacteria, and there's a close connection to Philadelphia because it was first described in 1976. If you remember, there was a Legionnaires' convention, and a lot of them came down, got sick, and died before we knew that it was a bacteria. And it's found in water systems. It gets in your lungs and can cause pneumonia. Now, the good news is we have treatment, but in people at high risk, people who are elderly, who have compromised immune systems, lung problems, they can get into trouble, and about 1 in 10 succumb to the illness. So it's important to find out where it's coming from.
What are the symptoms and treatment?
Well, basically, Thomas, it's like pneumonia, fever, chills, shortness of breath, many symptoms kind of like you get with COVID, which is another reason why it gets a little challenging, but it's easily diagnosed, and you get a chest x-ray and you treat it. But what they're going to be doing and what people need to do in Hamilton Township is, number one, make sure that your water temperature is above 120 degrees. Make sure you flush your system. Make sure that you clean those shower heads if you haven't done that in a while. And the authorities are going to be looking at where this is coming from. Could it be Trenton Waterworks? They're looking into it. But almost half of the houses they've tested have Legionnaires bacteria or Legionella in their water systems.
Check your water heaters.
Yeah, that is good to know. Yeah. Okay, Dr. Mike, when it comes to your blood pressure pills, when is the best time to take them?
Well, I've debated this, and researchers have looked at this for years. And we originally thought, well, you know what? Maybe it's best to take them at night because of chronobiology. They thought that that was a reduction in risk of heart attack. But this new study, 21,000 patients, found no difference if you took it in the morning or at night. So what I'm telling all you out there listening, folks, take your blood pressure medicines. It doesn't matter when. Take them. Just make sure that you take them every day.
Day or night. You know, real quick, Doc, when we take our blood pressure, we see the high number and the low number. What do those mean again?
That's the systolic and diastolic readings, and most people should fit in around 120/80. They're called Karatkov sounds. When you listen with the stethoscope, do you do that on yourself? Do you check your blood pressure? You hear the sound?
I do the two-finger thing on the wrist. I have no idea what I'm doing, but I make sure I'm still alive.
That's okay, Thomas, because I got you, man. I got your back. I love you.
You do.
And I love you too, Alex.
Hey, real quick.
I love you, baby. You're the best.
And we feel your love, Doc. We appreciate it. Real quick before we go, let's talk about statins here, because people who take statins, they sometimes feel muscle aches and they want to stop taking it. There's no link between the two?
Well, this research, there's a lot of controversy about this because I can tell you, after 30 years of practicing medicine, there are people who do not tolerate cholesterol medicines named statins. This is like pravastatin or atorvastatin, rosuvastatin. So this study found, based on their research, only about 10% of people that have those symptoms can directly be related to the medicine. But look, this is where you need to have someone like me, a healthcare provider, guide you through the shark-infested waters of healthcare. If you absolutely don't tolerate statins, we have other options. We have zetamide or Zetia, and these new medications that actually work in a different way. They're called PCSK9 inhibitors, Repatha or Praluent. Amazing ways to get your cholesterol down. Remember, if you have high cholesterol, you got to get it down so that you can live a long life. Make it to 110, baby.
You got it.
That's the goal.
All right, we're going to let you get back to your patient behind you there. I think he's not looking too well. So
he's been waiting too long.
A little too long.
Just like you guys.
Thank you, Dr.
Keep you waiting.
Mike.
Love you.
Love you.
Love you.